Good morning. I'm Dr. Sean Coomer, transplant surgeon and chief medical officer at the University of Kansas Health System. Welcome back to Open Mics. Today we're exploring a new approach to curing a horrible disease. Sickle cell disease causes terrible pain, leading to constant doctor's visits and often a shorter lifespan. But now new gene therapies promise to cure people who have sickle cell disease. Today we're meeting two people in the process of receiving these new gene therapies. But first, let's do morning rounds. Dr. Becky Lowry is here to highlight National Physician Suicide Awareness Day. Dr. Lowry is the Chief Wellness Officer and the Associate Chief Medical Officer of the health system. Good morning. You and I both know that our jobs can be extremely demanding, stressful, and at times very sad. It's nothing new, but the push for physician suicide awareness is relatively new. What prompted this awareness effort?
Yeah, you're right. That's a good question. There's probably 2 decades of published information about professional distress in our space. And I think in 2018, we really acknowledged that suicide and the high rates of death by suicide in our physician profession were important to keep as a part of the conversation. Really, this day allows us an opportunity to honor lives lost, to support those most closely impacted by that loss, and importantly, to really open the door to the conversation and the paths for help seeking.
So, Dr. Lowry, this isn't just our health system. This is nationwide, correct?
It is, indeed. That couple decades of published data are actually not even just national, but international. And so there has been a lot of progress in a space where we previously didn't do a great job of handling in a healthy way the unique stressors of working in healthcare and being a physician and a provider.
So a lot of times our colleagues, physicians, are reluctant to discuss their mental health because they fear it will affect their medical license or how they interact with patients. Is that still a concern?
That is a really important topic for us to, I think, acknowledge and address, because that has historically been a huge barrier to help seeking. And several years ago, at a federal level, the Lorna Breen Care Act was passed, which was in honor and memory of Dr. Lorna Breen, who was an ER physician in New York on the front lines during the COVID pandemic and who died by suicide. And she had shared with her family that she knew she needed help, but she was afraid to seek help because of the impact it might have with her colleagues or as it related to her ability to get her license or credentialing at the system level. So that really was a call to action for states at a licensure level and institutions at a health system or hospital level to address questions that might be barriers to help seeking on those forms and through those processes.
So I know you have some data on the need for more awareness here at the health system. Can you share that with us?
Yeah, absolutely. We are so fortunate to practice in a place where our health system leaders are aware of this critical need and aware of the need to lower the stigma and burdens to help seeking. So we have a pretty unique support system through the Professional Wellbeing Center, where we have psychologists who offer care for our colleagues. And that can be traditional reactive care, like after a tragedy or particularly difficult event, can be reactive for typical things like anxiety and depression. It also, though, offers proactive support. So if you want to go talk about ways to maintain healthy pathways for processing those chronic strains and burdens, they offer that as well. We've had over 1,700 appointments at our Professional Wellbeing Center in the short time it's been open by our physicians and providers, which is excellent.
That's great. So you mentioned the PWC, the Professional Wellbeing Center. What things inside the PWC that are available to support physicians' mental health?
Yeah, great question. So we offer the traditional counseling model, which is one-on-one with a PhD psychologist, who are 2 and soon to be 4 psychologists all have expertise in working with healthcare workers and understanding that unique strain and burden that happens in the healthcare space, where it's a high emotional investment space as well as a high stakes, high demand space. So there's that traditional counseling, there's couples counseling, and also some critical incident debriefing. So after really particularly challenging patient events, we offer a way to kind of swoop down and support the team in real time.
All right. Thank you, Dr. Lowry. Really appreciate you being here this morning discussing that important topic.
Thank you.
So now to sickle cell disease. Joining us today is Dr. Lyfgenia, a hematologist and oncologist. Dr. Lyfgenia treats patients with sickle cell disease, and Jody Wilson, a bone marrow transplant coordinator. Jody helps guide patients and their families through the blood and marrow transplant process. We also welcome back Linda Oga. Linda is living with sickle cell disease. Linda, you joined us earlier this year. I had the honor to be here at that time as well. How are you feeling today?
I'm feeling great today. I'm feeling fantastic today, but because of, scheduled treatment, so I'm grateful for where I am today.
That's great. So we're also joined virtually by another patient, Ian Wilhite. Ian also lives with sickle cell disease. We're grateful to have two different patient perspectives today. Let's start by seeing a little bit of Linda's journey. Alexis Del Cid shows us.
When 46-year-old Linda Oga moved to the U.S. from Nigeria in her 20s, she never could have anticipated it's where she'd one day receive a potentially life-saving treatment for the sickle cell disease that's plagued her since birth.
I was always crying out in pain as a child. Everything hurt. And when they would touch any part of my body, I would yell.
It's a one-time gene therapy treatment called Lyfgenia. The FDA approved it in 2023. The treatment is customized for each person by using their own stem cells.
Mostly excited, but right now I'm feeling a tad tired and no pain, so I'm good.
With her effervescent personality and infectious positivity, Linda's determined to stay positive in the face of the grueling 4-day stretch ahead of her.
Because of this anticipation of pain, they're having me stay in the hospital so I can be monitored during that time.
For 8 hours a day, she'll be hooked up to this machine, which removes and collects stem cells from Linda's blood. It's expected to cause intense pain and exhaustion. When we meet Linda again on day 2, the pain and exhaustion are high.
So right now the pain is at my lower back and on the top of my shoulders. A throbbing pain like this. It's like someone is hitting you with a hammer.
By day 3, the pain is migrated.
It started with a vibration, like a tingling, and the tingling started on my teeth. And so from my teeth, then it went to my jawline, and then the extremities of my bones, all the way to my toes.
And by day 4, it's no better.
My palms, both of them, even to the tip of my fingers, and the soles of my feet, it's like pins are being pushed on them.
But after intense nausea, her appetite has finally returned. She'll be discharged tomorrow. Next, Linda's stem cells will be sent to a special lab in New Jersey, where scientists there will genetically modify them into healthy cells. Then, Linda's genetically engineered healthy cells will be sent back to Kansas City to be infused back into Linda, with the hope that they take root and cure her sickle cell disease. But before that infusion can happen, she'll undergo 5 days of chemotherapy. Like we said, it's a long process. When we asked Linda on day 1 why she wanted to share this journey publicly, her answer was simple.
It is important for me to share my journey publicly because I've lost so many people to this disease. When I was growing up, I heard that there was never a cure. My goal, now that I found a treatment and I was lucky enough to stumble upon a treatment, I would like everybody else to know about this so that, they have hope.
Nothing is a sure thing. Just days after completing her stem cell collection, doctors determined they need more stem cells from Linda to make it work. So now she has to come back and do this process all over again before that next step.
Linda, thank you so much for sharing your process so far.
Of course.
How do you feel when you think about the road ahead?
I am super excited for the road ahead. Sorry, I'm emotional, but emotionally happy. It's just that I anticipated a 15-month period, but you know, such new medicine is not sure, is not an exact math, so to say. So as a result, it's tending to be longer than anticipated. As you heard, my second round of stem cell collection didn't go as much, we didn't collect as much as needed. So we're gonna go for a third round, and I'm hoping that that's the last round. But you know, there may be a fourth round and there may be a fifth round, whatever it is, I'm ready for that journey. You know, because it isn't all done until all the stem cells are successfully collected enough to be able to get me to where I need to be. So I'm ready for the next journey. It's just, I'm eager for it to be over.
Yeah, I understand. So not a date set for the infusion.
Yes.
But when's the next date for collection? Do you have
Stem
that?
cell collection is set for October 1st, which is Nigerians' Independence Day, by the way. So I'm like, liberation from sickle cell, yay.
All right, I like the connection. That's fantastic. Dr. Shunay, the word sickle cell refer to the shape of deformed blood cells. They cause a range of problems. What kind of problems do they cause?
So sickle cell means those cells are very stiff and they will clog up every vessel in the body. So you can imagine not having enough blood in your brain, you can get a stroke. If you're not getting enough blood in your lungs, you can get something called acute chest syndrome. Not enough blood in your joints, you get joint breakdown. Kidneys not getting enough blood, kidney problems. So this illness, sickle cell disease, is a systemic illness of the whole body that we have to address it at the root cause, because every organ in our body requires a very good circulation, and sickle cell is blocking the circulation, unfortunately.
So there are, as I understand, 2 different gene therapies for sickle cell. They were approved last year by the FDA. Linda's on track to get Lyfgenia. There's also Casgevy. Can you explain the differences between them, or even what they are?
So both therapies, they work. These are miraculous drugs that we have in our hands. So starting with Lyfgenia, which Linda will be getting. Lyfgenia is stem cells are collected, and then we insert a special cord that will then produce normal hemoglobin that will not sickle. So we are essentially replacing a sickling hemoglobin with a hemoglobin that does not sickle. And that will take care of business, Linda. Yes, you know you will. And then for Ian, he's going to get Casgevy. And Casgevy is, think about it this way. When you're a baby in your mom's womb, you had fetal hemoglobin. But as you were born and grew, that system was shut down. It was silenced, so you can have adult hemoglobin. But in Ian's case, his adult hemoglobin is sickle cell, is faulty. So what we're going to do is go back to the beginning. We're going to nip the silencer on your DNA and allow your body as an adult to make fetal hemoglobin. And both for Linda and for Ian, your future hemoglobin will not sickle. And you'll be freed from this sickle pain crisis, this organ damage. We can't wait for you guys to have a beautiful life.
That's pretty incredible. So turning things, reversing the clock. Is this the reversing aging, getting the fetal hemoglobin? That's pretty amazing. So let's bring in Ian Wilhite. Ian, thanks for being here this morning. You are the very first patient of the health system to start the process for Casgevy. So where are you in that process?
Well, I am excited for Lydia to finish as well, but I actually just finished collecting my 20 million stem cells and have sent them off to be edited. So pretty excited that I was able to finish those in 2 collections.
Okay, so you had 2 collections, and that got all your stem cells. So that's being worked on right now. So do you have a date set for the infusion yet?
Yeah, so unlike Lyfgenia, the Casgevy process takes a little bit longer. I will say what we expect it to be is a 5 or 6 month wait period while those stem cells are being edited. So I would predict, anywhere from, early 2026, probably around February is what we're expecting.
Okay, that'll be an exciting new year, that's for sure.
Yeah.
You live in Texas. So why are you coming here to Kansas City for this treatment?
You know, it's, I actually heard, I've now heard the full story, but back when these drugs were announced, I had reached out immediately to a few hematologists that I'd worked with, some from law school at Johns Hopkins, some that I see regularly while I'm in Texas, just to figure out the process of how to really start one of these treatments. And for a while it took, I mean, we were calling multiple hospitals and really not getting anywhere until Dr. Cole, who is my hematologist in Dallas, actually the story goes, she reached out to someone over, or a group of hematologists and oncologists over Facebook. And finally someone kind of raised their hand and said, yes, we'd be happy to take Ian. The reason why so many people and so many hospital systems had told us no was because they were only prioritizing pediatric cases. So anyone, you know, under the age of 18, they were willing to, I'll say, take the risk to start this process. Anyone like myself who is nearing 40, they were unwilling to do so, except KU. So we were very excited to hear the news that the KU team was willing to take us.
Well, I'm glad you found us and we found you. So, you know, beyond our patients that do all the hard work, there's somebody that does a lot of hard work to shepherd people through this process and deliver a lot of excellent patient care. Jody, can you help explain your role as a bone marrow transplant coordinator in this process?
Yes. As a transplant coordinator, I get to see the patients when they first come into our system. So with the physicians, I met Ian on that very first visit, and I kept thinking to myself, why are you coming from Texas? You have so many hospital systems there, but we're thankful to have you. And so I sit in those visits and I listen to the explanation to the patients and the families of their disease and what is being recommended for them, and then what the plan is. And then when the physician leaves, I typically stay behind and I just kind of re-educate, answer questions, and then let's talk about a plan. And you know, we have so many protocols and processes in place in our bone marrow transplant program. It's a fantastic department. But we just know that to get from point A to point, you know, B and point C, it takes a lot of work. The gene therapy patients, those are new for us, and I've told my physicians, this is honestly, after 16 years, this is probably the hardest process that I've ever walked patients through, because it's so long and it's such a roller coaster, and the pain is so intense for our patients, and my heart just goes out to them, and I want to help them, and I can't at this time, you know, but to look forward to that future. So just lots of testing, lots of appointments, coming back and forth from Texas. He's flown back and forth from Texas, I don't know how many times, 10 times, more than that probably, with this family, and trying to find somewhere to stay close by. And it's a lot on them. I am just honored to work with them.
Well, so thanks, Jody. So sickle cell disease can be already cured by bone marrow or stem cell transplant. So Jody, why might these gene therapies be easier on the patient? I know that long and drawn out, it was really hard. What's the easier part maybe in the future?
I anticipate the easier part will hopefully be like the long-term success, the long-term, maybe not so much effects on their body, I'm hoping. With stem cell transplant, you've got the effects of the chemotherapy, and then you've got someone else's cells inside you that are constantly fighting your body, potentially. So graft versus host disease, and that can go on for a lifetime, and the effects and the damage that can cause organs, or potentially can. Whereas gene therapy, of course, we don't know what the future holds because it is so new, but I anticipate that hopefully it will not have as many long-term effects on them.
Okay. Thank you for that explanation.
I agree with Jody. The other challenge with transplant has been lack of donors.
Yes.
You know, because you need to find, like for Linda, we couldn't find a donor for her, so gene therapy becomes the only option for her.
Yes.
You know, so gene therapy has made it simpler, much more available. potential cure because everybody can give their own stem cells.
Yes.
You know, and don't have to deal with the prolonged complications that you mentioned.
Yes.
Thank you.
Mm-hmm.
Yeah.
So, Linda, this is one of those diseases where you can look healthy and you're tough and joyous exterior is out there, but it doesn't quite feel that way, the fight you have going on inside.
Absolutely.
Do you ever meet people that don't understand that or don't even believe you when you say you're in pain?
Oh, all the time, all the time. You know, but we each have our crosses to bear, you know what I mean? And you just got to, you just got to keep going forward no matter what. And eventually, I think by the age of 10 or 15, I didn't really care anymore because I was just focused on trying to make sure I'm not in pain. And whatever I had to do, you know, legally, of course, that stood in those parameters, I did it, including, you know, being absent from ceremonies, being absent from some school graduations sometimes. Sometimes I remember one time everybody had already graduated and I came 2 days later because I was previously in the emergency room and I couldn't go to my graduation. So I collected my certificate later. You know, there was no big ceremony, there was nothing like that. But all my life has always been that way. You know, since I was diagnosed with sickle cell, and most of us, you know, that's the situation. Once you've been diagnosed, you just know your life is going to be different and you prepare for that. So yes, you can look powerful on the outside, but inside you're struggling. But you know, strength comes from, you know, our doctors, our friends, our family that keep supporting us and asking us, you know, because we're doing this for us, we're doing this for them, and we're doing this for our loved ones that have passed away. We got to keep going for them, and it doesn't matter what people think or don't think about the situation. You know what I mean? Like, you just do you and keep going. And that's been my main focus.
Yeah, you and Ian are great ambassadors for this, so thank you.
Thank you.
Dr. Shunay, we have to kind of get down to talking about cost. Because these therapies run somewhere between $2 and $3 million. Who pays for that and how do they pay for it?
So there's a big effort from our government to help cure sickle cell. It's a commitment from the National Institute of Health that we can and should cure sickle cell, because the upfront cost of gene therapy will be offset by decreased healthcare consumption for patients. And patients can go back to work and become healthy earners in our society. So the value of saving somebody from sickle cell far surpasses the cost of the gene therapy. You know, so the gain back is unbelievable.
Things are rapidly changing and evolving for our sickle cell patients. One of our BMT nurses named Sarah Steele recently shared her perspective.
You know, it's just really interesting how much changes all the time, you know, discovering new things, gene therapy, it hasn't been around as long, but even within transplant, within gene therapy, within cellular therapy in general, we're just always learning new things and finding ways to do it better, so it's exciting.
We are here to answer your questions. Please send them in using links on your screen to our YouTube and Facebook pages, or you can email the Medical News Network. Let's now check in with Dr. Dana Hawkinson. Recently there have been news articles about the CDC attempting to link the COVID vaccine to 25 child deaths.
Yeah.
What can you tell us about that?
Yeah, you know, we know that the new ACIP or CDC meetings will be occurring September 18th and 19th, so they are coming up soon. One of the agenda topics is going to be evaluating adverse events or deaths linked with the mRNA vaccines, particularly the COVID mRNA vaccines. What we should point out is that so far what they have presented to the public is that the data they are going to be evaluating comes from VAERS, which is the Vaccine Adverse Event Reporting System, which we have discussed, and Dr. Stites and I have discussed. We have been doing this for the last 4 or 5 years since the mRNA vaccines were available. What is that system? That system is just a general system for anybody to input information about particular problems they may have after a vaccine. Now, this system was around long before the COVID vaccines were, but obviously when the new mRNA vaccines came out, it was probably utilized quite a bit more. It is, again, a large general data input system. It is not used to draw conclusions or causation about one thing or another related to vaccines and adverse events. What it does is if you have enough people reporting certain things after a certain vaccine, it then lends investigators to investigate more and really try to parse out, is there an association of a complication with the vaccine? So it is just raw data. It is not used to draw conclusions. As an example, and we have talked about this before as well, there was one physician who put into that system quite a few years ago that he felt he was turning into the Hulk and his skin was turning green after a vaccine. He did it just to show and prove that anybody can type in and put in anything in that system. But now, again, if there are enough people looking for an issue and a signal of data that needs to be investigated, that will occur. These things have occurred with the VAERS system since that has been going, and especially since the COVID vaccines. And we would like to say is that the COVID vaccines are probably the most given vaccines in the history of the world. As of August 2024, we know there have been over 13 billion doses given. And just as a research part, we know that there has been a recent research article where they looked at actually over 17,000 abstracts of peer-reviewed papers, and what they still concluded was that the overall chance of adverse events in general for mRNA COVID vaccines was extremely low. The vaccine was extremely safe for all populations, including children and pregnant women as well.
Great. Well, thank you, Doc Hawk. Really appreciate it. We know many of you have questions, so let's head to Studio B with Dr. Alexis Del Cid.
Great questions coming in. Lin Yang Liang writes, with stem cell or gene-modified therapies for cancer, is there a risk that the modified cells could become overly potent, potentially triggering autoimmune diseases or causing incompatibility with the patient's body?
Dr. Shunay, you want to take that one?
I can take that one. So the engineered stem cells are patients' own stem cells. So there's no risk of rejection or autoimmune illness. It's quite safe, and we haven't seen any such side effects.
Jean Reardon has a question. Jean wants to know, is this disease totally hereditary? Does it come from just one parent?
It comes from both parents, actually. Both parents are carriers, and then there's a 25% chance that one of their children is a fully sickle cell presenting child. Yeah.
Marie has a question. She wants to know, she has two questions. First of all, is it possible to be a carrier and not have any symptoms of sickle cell?
Yes, yes, yes. In fact, most carriers have no idea that they are carriers. Mm-hmm. Yeah.
And the second question is, what is it about sickle cell disease that can lead to a shorter lifespan?
So when you clog the vessels, you cause severe organ damage. Multiple organs are affected, and that can cause a shortening of a lifespan. So a stroke or a heart attack or a kidney problem can result in a shortened lifespan, unfortunately. And that's why gene therapy is so important, because we can reverse that effect on the body and allow our patients to live a normal lifespan. This is our goal.
Okay. And Stu has a question about the pain. He wants to know, what is it about sickle cell disease that causes so much physical pain?
Go ahead, Linda. Yeah.
Okay, I'll be happy to take this one. I'm sure Ian will be happy to take this one as well.
Yeah.
But pretty much the sickle, once you are stressed out in a higher atmosphere, colder, you know, there's a plethora of triggers. Any one of those triggers, once that happens, your cell, the sickle cells that are not as healthy, they become even more sickle and clog up your veins. So once that happens, that means the other blood cells can't pass, and you have a blockage pretty much. And so sometimes there could be multiple blockages everywhere, including your arms, your elbows, your shoulders. So anywhere there's a blockage, there's subsequent pain. And the longer that blockage lasts, the longer the pain lasts and the worse the pain becomes. And that pain, sometimes a lot of people describe it as, it's like, imagine putting your hand in ice, and just leaving it in ice, like frostbite constantly. That's that pain sometimes. And sometimes it's like throbbing pain, like somebody's just hitting you repeatedly. Other times too is like when I have the acute chest pain, it is my chest, I can barely breathe, and then my chest is constricted. Sometimes it feels like I'm having an asthmatic issue, but it's just really my acute chest pain. So any of those things, when they are occurring, they start minimally, of course, and then they increase from, it can be anywhere from 1 to 10, but it quickly goes from 1 to 10 for a lot of us, and that's how come that is very painful. So when it starts, you want to start getting medical treatment. If it's a Tylenol that you want to take, or your heat therapy, or your blanket that you want to use for a moment just to see if that helps with the pain. Keep hydrated, that helps a lot as well. And if all those things haven't worked in 2-3 hours and your pain has escalated or doubled, it might be time to consider the breakthrough pain medications that you've been given. And if after a while that doesn't work, you can call your doctor. And a lot of times your doctor, if she's like Dr. Shanae, would be like, go to the emergency room right now. After they've asked you, how long have you been managing your pain? What have you done? How many hours? After they've asked you those questions, they can tell you, go to the emergency room to seek immediate medical attention. And Ian, you're smiling. It seems like you have something to say too.
No, I think you said it perfectly. I always like to remind people that, everyone's red blood cells do start to break down after about 120 days or so. Unfortunately, with sickle cell, ours break down so much faster, in the realm of 10 days, which puts our body constantly under much more stress. And again, those triggers could be anything. It could be not getting enough sleep, stress, stress from a job, stress from, taking care of children, anything. And that's what, again, causes that breakdown, leading to, again, more and more occlusions throughout your body and unfortunately more pain.
It sounds so intense. So thank you both for taking the time to share your journey. I do have a comment, and it's from Mimi J. Linda, do you know who Mimi J is?
Absolutely. She's my biggest fan.
Okay, well, here's what your biggest fan wrote. She wrote, "Hey sis, I'm super proud of you for continuing to showcase your journey. I love you. Mimi and Momo are watching, sis. What has been the best part of your journey so far?" And then for those of us who don't know Mimi and Momo, how are they related to you?
Absolutely. Okay, Mimi is Jamila. Her name is Jamila, my bad. Her name is Jamila Williams. She's currently the vice president of the Sickle Cell Midwest Association, which this is the association I found that now led me to sickle cell, to this gene therapy, and led me to all this information and resources that I really had no idea existed as an immigrant to America and as a sickle cell patient. I didn't know that the infusion clinics existed. I didn't know that there was a sickle cell clinic that existed. So through this organization, I was able to find those types of resources. And the journey has continued. This year, I joined them for my second sickle cell fun walk. Last year was the first time I ever did the walk. It was fun, and this year there were more people that joined me. And so, again, Jamila Williams is the vice president, and Momo. His name is Maurice Riddle, but I call him Momo and I call her Mimi. So Mimi and Momo.
Quite a duo.
That's who they are. Yes.
Jeremy Yenser has a question, and I'm going to ask this one to Ian. And Jeremy wants to share, I can't imagine being in pain all the time without being super grouchy. How did you learn to live with it happening all the time?
Yeah, it's a great question. I have to kind of credit my mom and my parents here. I think when we were younger, both me and my sister were both, dealing with sickle cell disease. And I think the way that they kind of always approached it was, even if we were missing holidays, even if we were missing birthdays. I remember one year I was in the hospital, I think it was for my 4th birthday, and my dad decided to get a camera recorder and record kind of like a scavenger hunt that my sister was basically the stand-in for me. So she would go around the house, reading the clues and kind of standing in for me in that way. But I think both of them really made an effort to try to keep our lives as normal as possible. Again, even if we had to miss school, try to get back. And again, we're very grateful to have such positive and optimistic parents who helped us navigate some really, really sad and, terrible times.
Well, this has been a great discussion. I'm extremely grateful to our guests for being here. I'd also like to get some final thoughts before we go. Jody?
I'm so excited for gene therapy. I see our patients come in and just a lifetime of their pain and their suffering that they've gone through, and it's just such a hopeful time. I'm really excited. Yeah.
Dr. Shanae?
Listen, guys, there's no age limit on curing sickle cell. We want to cure all sickle cell. So I would encourage all patients to come to us and let us offer you a life-altering treatment.
Linda?
Never take no for an answer. Keep looking, no matter what, not just for sickle cell, anything else that is going on in your life, health-wise. Don't take no for an answer. Keep searching. There are answers out there that you may not know, but my parents say a closed mouth never gets fed. So ask and you may receive. Ask and actually you shall receive. So yes, I was grateful that I was able to humble myself and ask for resources, and hence able to find this solution. And I'm just grateful for this journey and can't wait for the end of it.
We will applaud that when that occurs. Ian, any final thoughts?
Yeah, I'll just say, I think when you live with chronic pain, it becomes so normal. And I just want to remind anyone who's living with sickle cell disease, pain is not normal. It is not how we should be living. So if there are opportunities for you to, again, take advantage of either one of these groundbreaking treatments, do it as soon as you can.
Well, great. I want to thank Dr. Shanae and Jody as caregivers for this disease and shepherds of our patients. And Ian and Linda, thank you so much for being here. You guys are fantastic ambassadors for these new treatments, which is fantastic. But you're also, I know that you guys are suffering in silence, but with a huge smile. And I think that's why some people don't always know that there's pain. So thank you for sharing that with us and letting us be educated about that.
Of course.
So into our audience, we'll see you next week. And remember, help us out there, or anyone you know is struggling with mental health. This week we acknowledge our physicians.
Hello, I'm Dr. Kelsey Abel with Consultants in Gastroenterology. September 17th is National Physician Suicide Awareness Day. On behalf of physician well-being everywhere, it is a time to remember lives lost and raise awareness.
I'm Dr. Steven Solansky, and I'm a board member from the Kansas City Medical Society. Physicians experience one of the highest suicide rates of any profession. Each year in the United States, we lose between 300 and 400 doctors due to suicide.
I'm Dr. Becky Lowry. Approximately 1 million Americans will lose their physician this way every year. The suicide rate for female physicians is over 2 times higher than that of the general population.
I'm Dr. Robert Cooley. And for male physicians, it is 1.41 times higher. And among residents, suicide is the #1 cause of death, with first-year residents being the most affected.
I'm Dr. Angie Myers. Burnout is rampant. It plays a major role, especially in high-stress specialties like critical care, anesthesiology, emergency medicine, family medicine, and OB-GYN.
I'm Dr. Sean Coomer. We've all been touched by someone that has committed suicide in our field. We are working in high-stakes environments with limited time and too much stigma around asking for help.
I'm Dr. Jeff Norville from the University of Kansas Health System. Warning signs may include increased substance use, withdrawal from others, reckless behavior, or expressions of hopelessness.
Hi, I'm Dr. Carly Nickel with University Health. If you're concerned about a colleague or loved one, ask directly, are you thinking about killing yourself? Keep them safe, listen without judgment.
I'm Dr. Doug Rivard. Help connect them to support, like the National Suicide Crisis Line at 988 or the Physician Support Line at 1-888-409-0141.
I'm Mubin Mirza with the University of Kansas Health System. September 17th is a call to action. Learn the warning signs, foster open conversations, and support changes that make it safe to seek help.
I'm Dr. Jennifer Watts. Let's work together to ensure no physician suffers in silence.
I'm Alexis Del Cid. On the next All Things Heart, lymphoma, heart failure, and prostate cancer are not about to stop John Hill from achieving his dreams. The bond he has with his care team and the device that keeps him going. Thursday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.